Welcome back to Therapy Thursday. We're going to take a little bit of a different approach today, and we're going to talk about spine exercises. More recently, therapy has become very anti-flexion, keeping absolutely everything in a neutral spine, which for the most part may be the ideal scenario. However, that does not adequately reflect the demands of many sports. If you think about a gymnast or an aerial skier, or even to a lesser extent a baseball pitcher, they do require flexion and specifically flexion under load. And as a therapist or a sports therapist, we wouldn't feel comfortable having somebody return to their sport unless we've at least rehabbed them within that. So we're going to go through a quick progression of some flexion-based exercises that we use in clinic to rehab somebody at an end phase before returning them to their sports if there are flexion demands upon them.
To begin, we have a cueing or motor control exercise where we're trying to teach the person flexion through a variety of body positions. We simply put the person's thumbs on the bottom of their rib cage and their pinkies on the top of their iliac crest and ask the person to draw their pinkies towards their thumb, putting their lumbar spine into a slight bit of lumbar flexion. Here we see this in both standing and supine.
The next progression we utilize occurs with the individual on all fours. The cues that we utilize are to try to drive both your hands and knees through the floor, and then drawing your hips back towards your heels, similar to a baby stretch in yoga. Credit for our next progression is to Eric Cressy from a course we recently took. This next progression is a reverse crunch, which puts the lower back and lumbar spine under significantly greater load while in a compressed state. The progression can utilize just a reverse crunch as seen, or in this version, a reverse crunch with a slow and controlled eccentric phase followed by dead bug exercise at the very end by lowering one leg and then the opposite leg. A med ball slam is our final progression. This involves significantly higher force and can be utilized either straight vertically or with a slight rotation to better mimic certain sports demands. In summary, a person's therapeutic exercises do need to match the demands of their sport. In certain scenarios, flexion demands are required.